Hi guys, it's Dr. Spokane. This video PowerPoint presentation will be the first of several that we put out that talk about several aspects of orthodontic treatment and some of the products that we use in the office and why we use them. The first thing we're going to talk about today is fluoride. And I know fluoride's a big buzzword right now, and it's been on the social media, it's been on the mainstream news, and we're going to talk about fluoride, and we're going to talk about an alternative to fluoride called hydroxyapatite. Now, as all of our patients are aware, everyone's familiar with fluoride. Fluoride's been used in toothpaste, it's been used in mouth rinses, it's in drinking water. Fluoride has been used for decades by your dentist. And dentists have recommended fluoride since I was a child at being very effective at preventing tooth decay. Recently, however, hydroxyapatite has been used and researched as an alternative to fluoride. Hydroxyapatite is promoted as a more natural alternative to fluoride with less side effects. So let's start at the beginning. What is fluoride? Fluoride is a natural mineral. It's found in water, it's found in soil, it's found in rocks, and fluoride is actually found in some foods also. It's used by the dentist. It's used to help prevent tooth decay. It's used in fluoride gels, it's used in foams, it's used in varnishes, and it's used in pediatric dental practices, and it's used in adult dental practices. The primary benefits of fluoride is when fluoride touches your tooth surface. They are applied directly to the surfaces of the tooth, like we talked about, and the advantages are not so much from swallowing fluoride through drinking water or swallowing the different rinses that you recommended. Fluoride works by replacing minerals that are lost in your teeth. The main minerals that are lost are calcium and phosphorus, and these are lost due to acid attack by plaque, bacteria, and sugar. The process of losing these minerals is called demineralization, and it occurs more frequently in patients that have very poor oral hygiene and allow the plaque, acid, and bacteria to build up in their mouth. When fluoride incorporates into the enamel, it produces a product called fluorapatite, and that process is called remineralization. Now, fluoride is very effective at preventing cavities. Fluoride is also very effective at killing harmful bacteria in your mouth. However, fluoride also kills the good bacteria in your mouth, and this can disrupt your oral microbiome. The oral microbiome is that delicate balance between the good bacteria in your mouth and the bad bacteria in your mouth, and disrupting this equilibrium can actually lead to some systemic health problems. Overuse of fluoride or ingesting or swallowing too much fluoride can actually lead to fluorosis, which can cause your teeth to actually discolor. Studies also link excessive fluoride ingestion to other systemic problems, such as damage to your brain and nervous system. It also can lead to thyroid dysfunction and conditions like skeletal fluorosis if fluoride's used and ingested in excess. Now, let's talk about hydroxyapatite. What is hydroxyapatite? Hydroxyapatite is also a naturally occurring mineral, and it actually makes up a large portion of your enamel and bones already. Over 90% of your enamel and over 60% of your bones is already made up of hydroxyapatite. Hydroxyapatite also prevents demineralization from occurring to your teeth and encourages remineralization. Hydroxyapatite does this a little bit differently though. Hydroxyapatite directly puts calcium and phosphorus directly on your tooth surfaces. The hydroxyapatite that's used is called nanohydroxyapatite because of its small size. It actually fills in the microscopic scratches and gaps and integrates directly into your enamel. Hydroxyapatite does not kill bacteria like fluoride does, so disruption of the oral microbiome does not occur. Hydroxyapatite does, however, prevent the bad bacteria from sticking to your enamel surfaces. Hydroxyapatite, like fluoride, helps to reduce enamel sensitivity. Hydroxyapatite is also a natural tooth whitener, unlike fluoride that can cause discoloration of your teeth if it's used in excess. Accidentally swallowing hydroxyapatite is not a concern also. The minerals, calcium and phosphorus, will actually dissolve in your stomach by your stomach acid. For patients that are seeking a more natural product, hydroxyapatite may be more appealing to you than fluoride, especially if you have concerns about overexposure to fluoride. Especially with orthodontic patients where you are brushing your teeth multiple times during the day and rinsing your teeth multiple times during the day, there's more of a chance of ingesting fluoride. Whether you stick with fluoride or whether you stick to hydroxy or switch to hydroxyapatite, the key is to maintain consistent oral hygiene practices. This includes brushing your teeth properly multiple times per day, using your rinses as we recommend them, and yes, of course, flossing. And the most important thing is visiting your dentist every 6 months. And sometimes you have to see the dentist a little bit more often when you have orthodontic treatment. For those of you that are interested, we recommend David's natural nano hydroxyapatite toothpaste, and we keep it in the office as a convenience. When you're looking at this slide, it's either up here or over here, there's a QR code. If you scan that, it takes you directly to our website where you can find out more information about not only hydroxyapatite, but other aspects of our practice. And if you have any questions or concerns, click on the Contact Us Now button and it'll send an email to the office, and we'll be soon to get back to you as soon as we can. So enjoy your day and keep an eye out for more videos coming from Spokane and Karski Orthodontics.